Hey, good afternoon, everyone. It's always reassuring when the participant numbers start going up from zero. There's that, there's that worrying pause where you wonder how many are going to join us. Good afternoon and welcome to this webinar from the Institute of Place Management based at Manchester Met University. Really pleased we've got so many of you joining us to talk about the title of today's session, so Future High Street Alternative Uses. And we know this is a topic which has been generating lots of interest, and lots of practitioners and academics are busy doing this on high streets and studying it already. So I'm really pleased that we can bring a full session today with plenty of speakers to look at the types of uses that are coming onto high streets and how they're evolving into multifunctional spaces. So whilst you're all getting settled in, a few more of you are joining us, I'll just skip on just to do some introductions because I know that not everyone on the session today is an IPM member or perhaps even has attended one of these sessions before. So thanks very much if you're joining us for the first time. My name's Ms. Matthew Davis. I am responsible for membership and engagement at the Institute. And I'm joined by Ian Nicholson as well from the IPM side, who if you don't know Ian Nicholson, I'd be surprised in the place sector because probably one of the most well-connected people in place and has really been instrumental in putting together this agenda to showcase some of that multifunctional work. So that's us. Really pleased to have you join us today. Just to say very quickly, again, for those of you who aren't members already, this is an IPM webinar. There is membership available of the Institute. We are the professional body for Place, so we're a community of practitioners, over 1,000 of them, not just in the UK, but across the world as well. Anything from place leaders, place managers, people in development, as well as an academic side and a research side. So we run a journal and we do lots of research, as I say, based at Manchester Met University. So if you are interested in thinking about what that membership is, there's a QR code on the screen and we'll come back to this at the end. But one of the key things is we represent people in place. We help them improve their skills, but we really sort of shout for them and give them professional recognition because it's a really key field with a really interesting mix of skills. So that's what the IPM is. If you haven't come across us before, most of you will have done, I'm sure. And for those of you who are members, to make this an even more virtuous 90 minutes of your time, you'll be being awarded CPD points. So we'll make sure that we put 90 CPD points to your profile. Okay, so moving on, I'm going to hand over to Ian in a minute just to preface this topic a little bit. But I want to first of all say a massive thank you to the range of speakers. We can't have more than 5 speakers on these webinars because you can't actually fit them on a slide to introduce them. But we're joined by Harvey Braid, who is Development Project Manager at Queensberry Real Estate. Also Wayne Heel, Head of Property Services at Oxford Health NHS Foundation Trust. Both Joe Harvey and Mim Norvell, who are part of a group called Sustainable Wantage and also Wantage Mixed Community Hub. And lastly, but not least, Dawn Wood, who is the founder of Fabrication Crafts. And you'll get the impression from their titles, their organisations, that there's a real mix of things that this panel is delivering on High Street. So pleased that we can welcome them. So thank you very much. They'll give their own introductions as part of their sessions coming up. Just to hand over to Ian in a second, part of this session at IPM, we measure footfall types. We know that there's been a change in the pattern of footfall. So we have a term called comparison retail towns. And this shift to multifunctional isn't new. I think our stats say that between 2016 and 2019 in the UK, the number of towns that we would define as being comparison retail, so that would be their main function, in those 3 years, that dropped by 60% in our sample. So that shift is happening. We know that, and you'll have seen that from your own high streets. So today is really about, and again, credit to Ian, getting a bit of an insight from around the country. And this is not just big city centres, but smaller towns and districts as well. What is filling that space or adding to that retail mix as well. And just before I hand over to Ian, last thing, please do contribute to this session. So if you've used Zoom before, you can select to join the chat, or if you want to ask a direct question to one of the panelists, you can use the Q&A as well. So please do that. We've got too many people on the call to do hands up and sort of bring people in. It'd be a bit chaos, but absolutely we'll pick up on that chat. So Ian, can I hand over to you then, just to give a quick intro to today's session?
You can, thank you. And on the subject of the chat, the answers to the first two questions are: Rachel, you'd be very welcome to join, and Alan, yes, civic societies can, and you would be very welcome also, and we can follow that up after that. But on to the theme for today, and the real focus is on tackling vacancy and improving the mix of uses in our places. So typically, traditionally, we'd have been focusing on retail and hospitality and services. Those three things still have a really important, vital, and in some areas, growing part to play in our town and city centres. But encouragingly, we're now also able to draw on a much longer list. And that list would include arts and crafts, so makers collectives of the kind that you'll hear an example of today, creative uses, cultural uses, community uses, and again, we'll draw on one example of that today, leisure, which we're seeing much more of, education, and health and well-being, with the last of those possibly amongst the things with demonstrably significant potential to improve the vitality of our places. So we wanted to start some conversation around that to illustrate to colleagues who are place managers and place leaders who are working on tackling vacancy some of the ways that some elements of that new alternative uses or longer alternative uses list are starting to be brought into play. So it's great to be able to focus, as we will in this session, on examples of bringing health and well-being onto the high street, doing the same with arts and crafts and makers collective and community uses. And in the latter two cases, and the examples we've chosen, people who've been doing it for a good chunk of time and have therefore found something extra special into this conversation, which is ways to make these uses much more than pop up, make them sustainable over a long period of time. So I hope that by listening to our speakers today and engaging in the chat, in the conversation, and maybe picking up the conversation afterwards, you'll learn something that will help you to bring one or more of these uses into your place if that looks like a fit. So I hope you enjoy the session, and with no much more from me, let's introduce the session with Harry. Harry, over to you.
Thank you very much, Ian. Good afternoon, everybody on the call. So starting off today, I'm going to be talking through some of the work that we've been doing as Queensberry on healthcare, number of different projects that I'll touch on. However, as Queensberry, we are development managers. We are acting on behalf of ourselves as a developer. We also act on behalf of local authorities and as other private sector landlords as well. So we effectively oversee the delivery of a project involved in the feasibility stages, appraising the sites, leasing, and then delivery of the project, so procurement of the team, procurement of the contractor, etc., managing the budget, all of that kind of good stuff. So we are involved from the outset, really, and we work with all of those different people, delivering different food halls, competitive socialising, children's play operators, office space, build to rent, all of that kind of stuff within our town centre. So we are previously focused on retail, but as retail is dying away, we're obviously looking to advise and deliver different usage. So I'll talk through 4 different projects and the structure of the deals that we needed to do in order to make sure that these are successful. But obviously, I'll focus more on the advantages and disadvantages of the schemes, and why they're good for placemaking and for town centres. So there are 2 key ones here, really. The increased footfall being the main advantage, and the disadvantage being the capital spend that you need to kind of put in. But we'll touch on all of those in much more detail further on. So first project I'm going to talk about is in Wood Green. So it's in North London, and it's a CDC, which is Community Diagnostic Centre. There were 2 phases to the project, both delivered differently under different lease agreements, but then combined together into one unit. The phase 2 completed just at the end of last year, with great success. So there's a quick little floor plan of the basement space, and that's the key really to this project. Is we were able to put in MRI scanners, we were able to put in CT scanners and other diagnostics usage into the basement space of the shopping centre. This was previously vacant, obviously, because it was a basement, and therefore didn't attract any ERV to the space. So as an asset, it's increased in value just by being able to put this in. So the deal was structured in a certain way whereby it was fully designed and delivered by Capital and Regional, which was the client, the owner of the shopping centre. The traditional procurement route was adopted, so full design was prepared, mainly because of the complexity of the works. The interim valuations and all the fees, etc., were reimbursed to Capital and Regional on a monthly basis. So obviously that meant that the NHS needed to have the funds available to pay for that capital expenditure. This was obviously capped at a rate which was necessary, because as we were starting to dig into the basement or clear the basement, we discovered a few leaks, and as you can imagine, a leak on an MRI is not a good thing. So we had to protect the basement, which came at a bit of a cost and some complications on the projects. But like I mentioned, everybody was contracted to the landlord. We delivered the scheme with oversight from the NHS, and like I said, it opened back end of last year to great success. So this was a couple of pictures I took whilst the MRI was being delivered on the back of a truck. This was a £1 million MRI magnet, which was lowered into the basement. There was quite a significant amount of works that needed to be taken place in order to clear the route for the MRI, and it ended up being a couple of blokes pushing it down the hallway, which was quite interesting. But it was delivered successfully and without any harm. So I thought you might be interested in that. Now, this is another one with the same trust, in the same shopping centre. This was a deal that unfortunately fell through not last week, and I'll kind of go into the details of why that was. But it was, rather than a diagnostic centre, this would have been GP offices and some other space for charities and other usage overseen by the NHS. So it was an old retail unit with quite a significant space, an old new look space, 30,000 square feet. And just at the top, I don't know if you can see my mouse, but we were going to put in some kiosks, so some food and beverage kiosks and a cafe, again to attract the footfall into the area. This would have been done on a slightly different deal. We would have effectively, like a normal retail unit, we would have done the landlord works, so preparing the space effectively for the NHS to come in and do their fit out. But yeah, unfortunately, the NHS pulled out of this deal only 2 weeks ago. This was mainly because of some of the funding issues that they were having, new government potentially coming through, and what that might mean for their funding, and also some of the expenditure that they're having to put in terms of second staircases on their hospitals. So not necessarily dead in the water, but this is unfortunately not going ahead. Now, this is another project that we've been doing. This is in Ilford, so in East London, and this is a clinical commissioning group overseen by the ICB, so funded by the ICB, delivered by the trust and the landlord. So this was a different type of project. You might be able to see hopefully on the layout plan that we effectively had to amalgamate a number of different retail units. So it's quite complex in terms of making sure that we got the vacant possession of the space, and then preparing it through. very close to practical completion, and hopefully the NHS will be taking it within a week or so. So there's 22,000 square foot of space split over 2 different floors. Again, this is GP office, GP space, phlebotomy space, primary care predominantly, and then some of the GP offices as well. So quite a significant part of this centre being handed over to the NHS to operate. Again, this deal was designed and delivered by the landlord. This was a design and build procurement route, and the structure of the AFL, or the agreement for lease, and the lease is that the NHS would be repaying the project costs via an increased rent for a certain period up to a cap. So the initial capital expenditure is by the landlord, and then the operational expenditure is by the NHS. So you can see within these projects there are some kind of slight different deal structures needed to make sure that these work for both parties. As I mentioned there. So yeah, fully opening April this year, and handed over to the NHS hopefully later on this month. And just to touch on some of the advantages that I mentioned earlier in terms of the footfall into the space, there's an estimated visitors per day of just over 1,000. So as you can imagine, this is going to bring in lots of different types of people to be seen at the GP offices, all through the centre. So as a landlord, it's very attractive to have that increased footfall. This is a Queensberry-led scheme working with the local authority, and we again similarly delivering a community diagnostic centre over in there. So working with North East Lincolnshire Council. There was a number of different retail units. I think there were five or six, and this has effectively just been handed over to the NHS on a long-term lease. And at the end of the lease, they'll return the space with those units again. So this is a bit more of a hands-off approach from the delivery side of things, with the NHS designing and fitting out all of their space. And I mentioned some of the usage just on there. So 20,000 square feet, slightly smaller than the others, but still substantial in terms of what they're taking. And yeah, 150,000 appointments a year supposedly. So again, referring back to that increased footfall advantage, then as you can imagine, that's very attractive into the town centre. Now, some of the challenges, I've touched on them slightly, but the main one being the capital input required potentially. Some of the deals can be structured with operational costs, like I mentioned in Ilford, but that initial capital expenditure can be quite high. If it's been delivered by the landlord team and to be fair, the NHS team, you do need some confidence in the delivery. It's not a simple project. There's lots of different nuances, lots of different challenges, especially if they are being delivered in existing spaces. This comes really with the mechanical and electrical specifications required. So, for example, with the CDC, you can imagine a lot of plant to facilitate all the air changes and infection control and all that kind of stuff. So this was again a picture I took down in the basement, and you can imagine some of the service yard being taken over by big air handling units and all that kind of stuff. So needs that confidence in the delivery from both parties to make sure that they can make it work effectively. I've mentioned slightly some creative deal structures needed. So different people paying for different parts of it, and then stakeholder engagement. We need lots of confidence and lots of attention really given to this in order to make sure that the projects are delivered on budget and on programme for both of them. However, the advantages there's a lot longer list. You'll be pleased to know. This is over in Wood Green, a bit of a ribbon cutting. The generally achieves a higher rent per square foot than retail. Obviously, location dependent on the level of rent, but generally higher. Stronger covenant compared to retail, especially with the NHS, effectively backed up by the state. Longer leases. Some of the lease terms that we were looking at and have delivered are over 25, 30 years, which is obviously fantastic and in terms of the asset. So increases the yield and provide that greater level of return. So again, from a landlord perspective, if you're then looking to sell or whatever, then the value of the asset is improved. Halo effect. So within some of the centres, having that footfall of the health patients coming through, you might be looking at getting some pharmacies in there. You might be looking at some dentists. Lots of other different types of tenants may start to look and be attracted to that space just by that one deal. Obviously, if there's several vacant units around, then that's particularly beneficial. It diversifies the uses of the centre, town centre, shopping centre. Moving away from retail. It's again that destination, that placemaking side of things is beneficial for the landlord and the higher footfall. So that was key. But also during the quieter period. So this isn't just on Saturdays where retail is, it kicks on. It's during the quieter periods of the day and the week where people are attending appointments and coming through the town centre. Again, changing demographics. So rather than just people going to the shops, you might get anybody and everybody. I mentioned here, everybody gets ill. So everyone's going to need at some point to go to an appointment, need to visit that centre. And if it's in a location that's served well by public transport, which is obviously generally within town centres, got good parking, then it's incredibly useful to the community and to the landlord. So as you can see, the advantages list is much greater. It just needs the commitment from both parties to get to the point where you're realizing those successes. And that's my overview. So thank you very much. I will be on the chat box. So if you have any questions, then do let me know. Thank you.
Thanks very much indeed, Harry. In fact, could we just jump in very quickly, because we only got one in the Q&A, just a formal question, and it'd be good to catch it now. So Graham Galpin, one of our members, has asked, talking about he's tried to bring the NHS on site about 8 years back at a different location, and he met with some opposition from different GPs practices in the area. I just wonder if you had an experience of that, or is that another sort of complexity amidst what you've been doing?
Yeah, so we've done the deals directly with NHS trusts. Some of the GP practices then will come in as a sublease. We don't tend to get involved in that, although I haven't, for example, in these projects I've discussed, but we haven't really come across any opposition. I wonder what that would kind of manifest itself in looking like. But yeah, the only issues that we've had is kind of getting that deal across the line from that initial capital expenditure.
Yeah, great, thank you. And thanks so much for a really good presentation, as people are saying in the chat, really sort of lifting the lid on some of the complexity and obviously what you've been dealing with to get these things up and running, but as well some examples from other locations. Jackie in Poole talking about a local diagnostic centre for breast cancer diagnosis on the top floor of a shopping centre, doing the same, increasing footfall, etc., but obviously facing some of those challenges of business case, where do you get the equipment from, etc., etc. But yeah, really fascinating. So thank you, and we'll stick with that theme. If I could invite now Wayne Heal, who's head of property services at Oxford Health NHS Trust, who is going to stick on health on Oxfordshire's high streets. Thank you, Wayne. Oh, you're on mute. I'm sorry, but you've shared the slides beautifully, but we can't hear you. There you go.
A bit out of practice with Zoom, so thank you, Matthew. So yeah, I'm Wayne Hill, head of property at Oxford Health. I've been with the trust about 9 years. I'm responsible for the trust estate strategy and manage the acquisition disposal programs and the transformation side of things. So we've got quite an innovative program, which I've been looking forward to talking you through in a moment. Just a bit more background on the trust itself, because I think it's quite helpful. So we're not an acute trust, so we don't do the diagnostic stuff that you've been hearing about previously. We are focused on community healthcare in terms of mental health and dealing with the elderly individuals. So covering things like podiatry services, district nursing, health visitors. Actually, a lot of the stuff that we all have quite regular discussions with. You know, a lot of you see these sort of services around a lot. We've gone through a big rethink of how we deliver services in the organisation, and this program kicked off about 2 years ago. It is an exciting program, and we're now into the second phase of it. So I'll just take you through where we've got to, but a bit more background first. I mean, the idea was to just revamp the delivery of mental health services. You're probably very familiar with the sort of the institutional style setting that we see all across the country, and we hear a lot in the news about long waiting lists and people not being able to get the care that they need, and that's relevant for community services like CAMS, the children's mental health, adult mental health services. So we've gone through a long exercise of thinking, well, what could we do differently? And we set ourselves a number of important goals about creating facilities where people can just drop in off the street. So that is the type of model that works for very well in a retail type setting, and really improving access, because again, a lot of the facilities historically have been on hospital campuses, perhaps tucked away in old tired office buildings, not necessarily the most prominent facilities that you'll see. So we've switched our attention to providing care in settings that are far more accessible and in areas of deprivation, and that's something that I really wanted to underline today, because that is one of the absolute primary focuses of this organisation, is reaching out to the people that are hard to access historically. Care that's more personalised, it's that one size fits all model of what people need. It is not working, and it's therefore enabling people to come off the street and talk to us, my colleagues, about their general well-being, and then start a journey with them. It's about partnership working. We're not doing this on our own. Yes, we are the party that's taking the legal risk, if you like, the sort of commercial risk associated with this, but we are linking in with a lot of partners, and we work with organisations like Mind, who you'll be familiar with, but organisations that are also more local to Oxfordshire as well. It's about prominence. I've mentioned previously about how often our sites are not in the best locations. They're often cheap. They've historically organically grown into those locations because they've been relatively cheap, but the access issue has often been something that's held us back. And I think with mental health and the stigma that comes with it, it's thinking about how you can move away from that institutionalized setting. Now, with each of these goals, we've achieved them, and we're now looking to build on that going forward. So I think this is something quite exciting and will become a dominant theme in the future. Now, where are these facilities? We've got one in Banbury, which is in the Castle Quay Shopping Centre, and there's an image there to show you what that looks like. The actual shopping centre is owned by one of the district authorities in Oxfordshire. We don't have a unitary authority. We still have lots of little districts making up the county, and we took a lease from them. Now they are one of the organisations that are struggling with high void. So this is I would say a classic One Public Estate initiative, albeit it wasn't funded from One Public Estate. It came out of building relationships with those individuals that work for that organisation. So we've taken a lease in a prime spot in Castle Quay, and that opened over a year ago. Moving on, then we went to Abingdon, where we opened our second facility, and that's a very similar unit that was leased from a fund based in London, so a very different entity. But it just goes to show the range of different landlords that you might be dealing with. We're now in the process of fitting out a premises in Cowley in Oxford, which is close to one of the more deprived parts of the city. I know you might think, God, Oxford, I only hear that it's a rich place, but no, it has some of the most deprived parts of the country. Most cities will have these areas, and Oxfordshire is no different. In fact, the range of inequality is quite stark. We're moving on to Kidlington in the coming weeks. We are just about to complete a lease there, and then we are moving our attention across to Wantage, which will open in the summer. So these are all deals that have been done, and with the exception of the Wantage one, which is still in legals, we are commercially obliged to carry on. Now, I thought it's important to sort of highlight we're not in this for really short term or freebies. We are signing up to a commercial rent. We've negotiated them as any tenant would do, as a willing participant, and we are paying a rent. We are paying all liabilities you'd associate with this. So this isn't about the NHS coming in with its begging cap and saying, well, come on, we want a free deal here. No, we are coming into this, and we are adding to the investment value of these shopping centres. So we've taken minimum 5-year terms. That's the most we would be prepared to take at this moment in time, because arguably this is more of a pilot for the time being. But based on the success that we've had in the first couple of years, it's highly unlikely, I think, we're going to be breaking away from these buildings. And just to give you a flavour, we contribute towards business rates, the service charges in the area as well, so that brings money locally. I think with business rates, we would probably all say that there's something needs to be done, but we know that's a political issue as much as anything else. But we have, where the opportunity has arisen, advocated for a revamp of that, because it would make our lives a lot easier if we're not having to contribute so much to the substantial business rates. Now, how are we meeting our goals? I've mentioned that we feel this has been a very successful program. I mean, we have an in-house team that have been brought together to deliver this, which includes an architect. We have property managers. We have an FM team that are wrapping around this, and we're doing the fit out ourselves with a local contractor. So it's a lot of coming together and rethinking how we deliver estates functions, and not relying on others to do it for us. I mentioned the One Public Estate initiative, and that's really important. Just this morning, I was on a call with our colleagues in Buckinghamshire. Despite the name, we're actually in Buckinghamshire as well, and Wiltshire, so we're quite a big organisation. And we're looking to develop a programme of One Public Estate and health on the high street there. We've developed a good programme and management technique specific to this. The level of due diligence that is required is substantial. There's no getting away from it, and having just robust checklists and program management it has enabled us to sort of move through these processes quite quickly. We have a comm strategy, and we've engaged with a lot of very well-known celebrities who have come and opened the units for us, and we've got some quite exciting ones for Oxford in the pipeline. I won't say who they are, but because it'll probably be bad luck. But yeah, we've engaged and had some really good feedback from famous people who have been part of the process with us. And we are measuring footfall, because we know how important that is. It particularly helps the One Public Estate conversation, because if you can demonstrate that people are coming through the front door, then they're probably or possibly going for a coffee next door, or they're visiting the local library or doing other things. So we are capturing this, and I'll come on to that in just a moment. So then, how are exactly we thinking about making sure that this works, but it's not just a story, a narrative that we're coming up with. It's actually built on hard facts. And some of the things that we've done is included some sensors in the units. So we've actually got these footfall counters. I'm sure retailers have been doing this for years, but it's a very simple way of just measuring how many people are coming and going. Not particularly great in terms of understanding who those people are, because it will pick up on our staff and everybody, but at least it gives you a flavour of what's going on. The next bit is the patient feedback, and that's where we are recording or asking people to record what their experience was like. We're then following that up with interviews, and we've commissioned an organisation to come in and do some deep diving around this and actually interview the commissioners, our staff, and just get a better feel for how this is working on the ground. We know from GP referrals that we can monitor how many people are not going through the GPs directly and are self-referring, i.e. dropping in off the street, and how much pressure that's starting to have take away from the GPs, because a lot of the problem is they're getting backed up with requests. a lot of those requests are very straightforward. I go and speak to a mental health practitioner, that sort of thing, and we're trying to bypass that to take some time away from them. The patient questionnaires are also a big part of this, and then we can learn. We have adapted the first from the first couple of units that we've done. We've learned a little bit about what worked well in those units, so that's part of the next phase of fit out that we're working on. Where next? So this isn't just this isn't the end. We talked about Whitney this morning with colleagues, and we're looking at potentially some opportunities with the district council, who own some retail space, and towns like Bicester and Didcot are on our radar. But perhaps more slightly faster pace will be what's going on in High Wycombe. There are colleagues in the Acute Trust have developed a facility in Aylesbury, and they are talking to us about something similar in High Wycombe, which has more of a mental health component as well. So quite a busy time. These things do take a long time to do, but it's nice to see them now landing, and we're learning from the exercise. So it's quite exciting for us. Thank you.
Thank you, Wayne. That again, really brilliant to get that amount of detail and insight into what are really complex projects. And we've got a few questions in the Q&A. We've got a couple of minutes, so it'd be great to cover off one or two of these. I should say, if we don't come to your question, we'll do our best to coordinate after this so that we can get some answers out, because there's a lot of chatting going on in the chat, which is brilliant. We like that. So Wayne, you talked about not going cap in hand and sort of, paying your way, etc. But obviously there's some economic realities of what you're doing. There's a question on the one public estate that you referenced with reference to Banbury. Have you co-located other services, or is it just NHS services? And if you have co-located others, is there a specific financial model, because that's been causing others issues in terms of trying to do that?
We didn't we've set up with a charity organisation that will provide some catering facilities, and that's something that we're working on more broadly. But we haven't. The One Public Estate initiative is effectively us leasing the building from the local authority who own the retail park. Just around the corner, there is a library also embedded in the shopping centre as well. So that's been done in tandem with this, with county colleagues. So there's been quite a big push to try and bring in public sector services into the unit. And as I said, we've negotiated commercial terms with them. We felt it was important to do so. It brings everybody with the right mindset into the discussion. There is some scope through One Public Estate for some priming, some initial funding to get things get business cases developed. But as we learn, and learn from the experience of doing this, there's perhaps less need for that. What they won't pay for is the day-to-day revenue spend associated with the programme. You have to put your hand in your own pockets for that.
Yes, yeah. And then just one other, and again, apologies if I'm missing out the question. Just an interesting one actually raised on, specifically about the mental health services, but I suppose it's more broadly about location. You mentioned obviously there's a benefit of getting out of the clinical setting and into, an urban setting, city, town. Could you just tell us any other considerations about location in terms of what the kind of catchment is clinically that you're trying to reach, or is it more about where are the opportunity spaces?
There is a little bit of this opportunistic element to it, because we've got, despite what we see in the press, to some extent, there is a relatively buoyant market still in some pockets of Oxfordshire, perhaps reflecting the wealth that's in the area. So there is an element of, actually, we're not necessarily got all this bargaining position on our side, and we have had to follow a few opportunities that perhaps are slightly outside of the area, but prominence is really important. The one that we're currently fitting out is an old Costa Coffee store on Cowley Road, which is quite a busy arterial route into the city, and that's prominence. But also, I think it's the deprivation aspect to it that's really important as well. And we know from indices that are well published by the local authorities in the healthcare sector that there are communities in most cities, most towns, that are not accessing services which they often need, and we need to move closer to them in order to improve those opportunities for them. So yeah, we are certainly following the client as well, if you like, and to put it in a slightly commercial way. But that's the reality of this.
Yeah, thank you. Thank you. Very clear. And a good example to end on, there's something quite neat about health services going into an ex-Costa coffee. When for so long, sort of Costa coffee's going into health services. So yeah, but thank you for that presentation. Really good. And if we carry on the link, so we're going to change from the health sphere now. And we're going to hear from Joe Harvey primarily, and we've got Mim Norvell as well standing by to help answer questions and chip in, I think. You'll hear me padding as I'm just sharing my screen, so hopefully you can see the slides now, and I will drive this for you, Joe. I think the link, actually Wayne mentioned Wantage being on your list coming up soon. So we're going to move to Wantage and think about other uses in that space now with sustainable Wantage. So Joe, over to you.
Thank you. Yes, we'll be neighbours, Wayne. Looking forward to that. So yeah, we're very much the other end of the scale. This is a bit of a story about what happens when a group of local people manage to get hold of an empty shop. So my name's Joe Harvey. I'm the Sustainability Coordinator for Sustainable Wantage. We're part of Oxfordshire's Community Action Group network. We have about 100 members, and we're all local people living in and around Wantage. So what does Sustainable Wantage do? Our aim is to find ways to live more sustainably, share this, inspire others to do the same, hopefully. And we had to register as a community benefit society back in 2013 in order to have a legal form to be able to take on leases. And one of these is our biggest project, our town centre hub, which is the Mix. So this is the Mix, former off licence. I'm going to run through with you what the Mix does now, and then give you a bit of background to how we got started. So the Mix is open 3 days a week, Monday afternoon, Wednesday daytime, Saturday morning, with things happening behind the scenes at other times, some things in the evenings and weekends, kind of ad hoc. Some things are hires, local groups using us for meetings, things like that. Some are our own events. We're only officially open 12 hours a week, but we have an awful lot going on. On the next slide, you'll see one of our main things is our community fridge. So this is a setup where we collect surplus food from our local supermarkets, the bakery, the stuff that they have to take off their shelves when it's reached its best before date. After that, they can't sell it. We can collect it and give it away so that it doesn't go to waste. This brings in about 200 visitors a week popping in for a loaf of bread and some fruit and veg. It's open access, so anybody can come and collect food, but obviously it's more useful for anybody who's struggling a bit. And it's a really good engagement point for people who maybe need a bit more support. We do quite a lot of signposting to other services as well. So there you can see how much food we got through last year, just by walking up and down the streets of Wantage with shopping trolleys full of baguettes and random things. Every gingerbread man adds up. On the next slide, you'll see our refill station. So we have detergents, household detergents, shampoos and body wash, that kind of thing. And this is where people can bring their own bottle and buy the stuff that's in the bottle rather than a new plastic bottle. We saved over 2,000 plastic bottles being made last year by serving things in this way. And as well as avoiding the plastic, these also support us to keep the Mix open, so we get a little bit of income from these. One of our most popular activities in the Mix is our monthly repair cafes. So this is a case of making the most of the skills in your community. We've got a bunch of volunteer fixers who can take apart and put back together a whole range of stuff. They like a good challenge. They like the random things. It's a really useful service to the local residents, but it also gives purpose and an opportunity for learning and a bit of a family for the volunteers. It's a really lovely thing to be part of. On the next slide, you'll see Wilfred the Bunny. So a lot of the things that we fix are kind of household electricals, and the aim is obviously to prevent the waste and also to save people having to buy a new thing, so saving people a bit of money. but a lot of the things we fix also have sentimental value. So Wilfred the Bunny, 70 years old, he had one of his ears chewed off by a dog. But one of our fixers managed to find a matching fabric. She washed and carefully dried all the little pieces of the broken ear and used it as filling for the new ear. So he still has all of his parts, his original parts. And yeah, passed him back to his very happy owner. The repair cafes also spawned other repair projects. We do laptops, which we started in lockdown with local schools, particularly where families were getting in touch with us saying, you know, we've got 4 kids and 1 phone, we can't get everybody online at once. We did about 500 laptops in about 12 months. We also get job centre referrals. Now everything's online, and local referrals from the food bank and the advice centre for that. We do bikes. So we get donated old bikes. We've got some volunteers who fix those up. So trying to help people switch away from car journeys, particularly short journeys around town, and also a free way to get to work, free healthy exercise. And this grew into a project with schools, where we did a lot of bikes for year 6s. So when the schools do bikeability training, what used to be called cycling proficiency, if you haven't got a bike, you can't do the training. So we tried to make sure that any children in year 6 who wanted to get involved with that when their schools were offering it had a bike with which to do so. And here's 2 of the girls up at one of the local primaries trying out their not new bikes. A project we started just last year is our Library of Things, which is exactly what the title says. We did this because basically everything we need in life probably already exists somewhere. Don't need to go and buy anything new. You can just borrow something, so you're avoiding having clutter in your house. You're saving yourself money just by sharing, and somebody else has to check whether it's working and pack tested, so it's all good on you. It's really cheap to borrow something. So for example, the pressure washer is £3 for 2 days, and it's just having a bank of stuff that we can share as a community. We also do workshops and courses, various different things in the space. Sometimes it's things that people ask for, sometimes things we think would be useful to share. And sometimes when people come along, they say, oh, I know how to do this. Can we put on a workshop so I can teach other people? So all kinds of things, from like sewing to plumbing. You've jumped ahead of me there. And this does have quite an impact, I think, on footfall. We've had people coming to Wantage from quite far afield when we've offered something very specific, like upholstery or a willow weaving day. And then people do pop out for a coffee, pop out for lunch, check out what's in the neighbourhood while they're here. So it's a useful point of contact. We also have collections for hard to recycle waste streams. We collect toothbrushes, printer ink cartridges and writing instruments. Those go in to be recycled. We found it's really important to have multiple reasons for people to come into our space, because some people are just starting out on their sustainability journey. They might pop in with a handful of like dead biros while they're passing because they heard we collected them. Or we have people popping in to say they've just moved to the area, they're really looking to get involved and want to find out more about what we do. Having a public access point for Sustainable Wantage massively increases our reach. It's really changed us, I think, as an organisation, and hugely expands the opportunities for people to engage with us, and therefore the skills and the experiences within our community that we can draw on. So I don't have the figures yet for 2023, but just to give you an idea, here's 2022, how many people got involved and how much time they gave us. It's absolutely amazing to me to see what can happen when people come together and everybody does a bit. It really, really adds up. This is across all our projects, but really results, I think, from us having the mix and having this public face that people can come and engage with. It's a huge advantage to a group like ours being able to have something in town like this, even though we're only open 3 slots a week. It keeps us in people's minds, and it just hugely increases the impacts that we can achieve. So to give you an idea how we got started, back in 2013, the District Council funded town team projects was focusing on empty units around Wantage and provided some startup funds towards refurbishment. We had, I think it was 23, 26 empty units in the town. Mim, you're going to have to remind me, sorry.
23.
23, thank you. And 9 of these were on Mill Street. So Mill Street really did need a bit of attention. We're in number 15, so halfway down the hill. When we took it on, it was a boarded up former offie, really poor condition inside and out. We had a deal where we took it on for 6 months to get it into a usable condition and had a further 6 months use rent-free. And thereafter, we had a lease agreement and started paying rent. And we've been here just over 10 years now. Sometimes a little bit by the skin of our teeth, I have to say, but we are still here. Right at the start, we had a lot of local tradespeople give their time for free, and it absolutely wouldn't have been possible without that support at the beginning. So the next slide is about funding, and my main message here is you need lots. Basically, we had quite a few challenges with funding, so especially at the start, trying to get funding before we could prove what the mix could do, so without having any kind of track record. We had quite a few funders who weren't keen on paying rent to a private landlord. Funding hours for people to manage things was much harder. There are more options for that these days. And funders always seem to prefer new projects to core costs. So we were constantly having to start new things, but you also have to carry on the old things that are working fine. And so it's a bit of a juggling act. And planning was really difficult, I'd say, in the first few years, because often we had enough money for the next 3 months or the next 6 months. So you can only look so far ahead. It's taken us a lot of time and energy to get where we are now, but definitely worth it, I think. If you're looking to start up something like this, one thing that's absolutely crucial is the support of your community. So as I said, volunteers working on the building in the beginning, volunteers running sessions, putting on events, local residents feeding in ideas. And this was really, really obvious to us in the first lockdown when our newly established at the time community fridge went into delivery mode. So we carried on collecting food and getting it out to people as deliveries, and volunteers across all our activities stepped up to help. So we had the craft club leader doing deliveries, we had the treasurer doing deliveries, the repair cafe volunteers doing deliveries, and everybody getting involved. You really need people on your side to get something like this working. And yeah, that's the story of our little space in Wantage and what we've managed to do here. We've had so many visitors over the years from further afield who come in and say, oh, I wish there was a mix where I live. I think it's a really brilliant use of an unused space, and I would encourage anybody to set one up, and do get in touch if I can help with that.
Thank you, Jo. Look, absolutely awe-inspiring. I don't think that's an overstatement, because all the activity, even just looking at that funding slide, made me sort of anxious, and I had to look away, because how you manage that is incredible. And I should say, I know you're good at multitasking, because whilst you've been busy presenting, Mim, I think, has answered all the questions in the chat. So you probably got a free pass. But I suppose if I could just, before we move on to the next presentation, just a question from me on it was a great point to end you made about you really need the help of everyone in your community. I wonder if you just mentioned to us sort of, were there a lot of existing sort of formal groups and partnerships that you could tap into, or was it a very organic thing where people just started popping up and saying, hi, I'm Dave from down the road? Who were you able to tap into to get support?
We have had people come from all kinds of different directions, and more people have found us just by us having a public space, I think. But yeah, there was a core group of us in the beginning when we got started, and everybody tapped up all their contacts for all the help that we could get to get going. But yeah, we have really good links here with our local food bank, our local advice centre, the local schools. So and
Yeah.
anything and everyone, I think.
Yeah, great. And one last one then before we go on. Melanie's just asked, Joe, that you said you need lots of funding and you listed all the sources. And she asked, is the project now sustainable without funding? Can it pay for itself? I'm going to guess no, but you tell me.
Short answer, no. Unfortunately, no. There's a lot of services that we offer that are never going to cover their own costs. So yeah, whilst there are things that we do that do make a bit of money, things like the community fridge, basically it's just a service that we're putting on for free.
Yeah. Sure. Yeah, really, really important service. Sorry, Mem, did you want to come in? Yeah.
Yeah, just to say that I think once you get established and you get the trust of more funding comes. So we had a very significant funding success with community lottery, which covered us for 3 years. And part of that is planning for financial sustainability. So we're going to be looking at our business plan type stuff, you know, what we could do more perhaps in the retail area of the work that we do, those kinds of things. So we got that chance to do that, has bought us the time to do that.
Yeah. That's great. Okay, well, thank you, Joe, Mem. That's a really valuable presentation. We're going to move on now to our last presentation. So I'd like to invite Dawn. I'm actually going to drive your slides, I think, as well, Dawn, so that's good.
Thank you.
And I've definitely got them here. Yeah, so Dawn, as I mentioned at the top, you're the founder of Fabrication Crafts. So sort of sidestepping from sustainable wantage into a connected area in terms of crafting and what your organisation does. So I'll hand over to you.
Right, thank you. Yes, so my name's Dawn and I'm the CEO of Fabrication Crafts. We set up in 2008 and we're a social enterprise that supports local artists and makers. We initially set up, we managed to get a £5,000 unlimited award at the time. It's kind of before the craft revival. So it's quite and co-working spaces. So it's quite an unusual model at the time. Thankfully, a lot of people have replicated it. And we actually set up because myself and my hubby needed somewhere to work. And once we had that somewhere to work, he moved up from London. We were both specialist craftspeople. We then had a space that other people could come and use our machinery and the tools, and we could run workshops because suddenly I had a space to teach my friend how to sew, etc. So we started with like that, really. We've not been funded since. We've grown organically until COVID, when we were finally Arts Council recognised, and we managed to, like others, kind of get that, and we've grown organically. My background is that I'm a fashion designer, costume maker, wedding dressers, make for film, theatre, museums. My husband was a very specialist craftsman, doing metalwork, leatherwork, embroideries for, again, museums, the royal household, films, theatre. And there was nowhere that we could both have a workspace together. So what you do is you set your own up, really. We managed to get a grubby little damp hovel that was waiting to be knocked down in Leeds for not much money, and that's where it started, really. A couple of years later, in 2011, we opened our first shop. It was something I'd always wanted to do, and invited a lot of other local makers in to join us. We work in a very odd way, in that everyone pays to be in, everyone works. And the reason for that is that as a maker, pre-Facebook procrastination days, I know full well the kind of loneliness of working on your own. So by making people work in the shop, it does three things. It helps mental health, helps self-esteem, and mentors them into growing their business. It also means we don't have to pay staff to run the shop. I don't have to run it on a daily basis either, as well. So we can kind of build a community amongst each other, really. It's not my shop. It's not the organisation shop. It belongs to every single maker in there. So we run as a cooperative. Like Wayne's, we kind of build a community. My name is just on the lease, basically. I run, my name, I kind of make the some of the decisions. I, drive it, but my name is actually just on the lease, and it's up to everybody else as well to make it work. Roughly the rents kind of cover about half of our utilities and rents, and commission hopefully covers the rest. Since COVID, it's been a little tricky, but that's the way it goes with most city centres kind of recovering. We have a shop in Leeds, we have a shop in York. We've actually just opened our 8th entity of retail, really, and that we started, so this is our current York shop. We moved into York in 2018, and we took on a little 16th century hovel owned by the National Trust, and we took it on for about 4 months. We were there 4 years, we moved out in May 2022 with the National Trust to start the renovation project. And we were lucky enough, we took on directly opposite, so we didn't need to redo marketing and PR, the River Island, which was stuck a note on the end from 500 square foot to 5,000 square foot of River Island, with lots of storerooms, which we've turned into photo studios. We have exhibition space. Upstairs, we have workspace. We have a messy workspace downstairs we're working on. We took a 2-year lease on that. Not paying full amount, but we were paying the full rates, which on a River Island was, even with COVID rate relief, was about 50 grand a year. So we a lot to cover, really. In 2012 we took on a 3,000 square foot pop-up for a month, and then 6 months. Then we're there for 6 years in a Scavell owned scheme in the Light in Leeds, which also meant that we had about 90 sellers in there. We were then kicked out of there after 6 years. We were just at the point where we could take on our own space, and we took on a 10-year lease on a shop in Albion Street in Leeds for full rent, which again was about £45,000 a year, and matching rates. So have to make it work. We really have to make it work like any other shop on the high street, really. We moved from there at Christmas. We took a new space, which again, the images there are of on Briggate. We're almost opposite Harvey Nichols on Briggate. It's the dream that I had when I was 12, that I would have a shop on Briggate, selling my clothes. At some point, it took a long time. I'm not saying how long. We've been doing this a couple of centuries now, and so we took that on. We move in within about a month of getting the keys, and we never have any money to do it with. We run to the wire because it is just what we earn. There's no funding to do it, and we're very lucky in that because we have around 100 makers we work with, that we all have different skill sets. So we have the teams that are good on social media, and we have the teams that are good on building a website, and we have the teams who are great at DIY. So, when we went into River Island, we took walls that we were in there about 6 months, and then we took walls down and made it our own. And with this one, you can see what it looked like in the first place. We had to move some walls because it zigzagged, and we've all got our skill sets. We've got the ones who are good with power tools and angle grinders, and the ones who are good with a paintbrush, and those who are good at just cleaning floors. This shop, actually, we opened it, we'll say to anyone looking at taking on the space, if it's got carpet tiles down, even if they're giving you £1 million to take it on, run a mile. We would have opened in 2 weeks. Apart from carpet tiles on scree, you could never get the glue up. So 4 weeks and many paint fumes later, where we all had no oxygen left in our bodies, and we were even the local drunks were coming in and checking we were all right and weren't fumed to death. We just left it, and now it looks like an anthropology, artistically designed, urban chic floor with painting. We painted on it. So what do we do within the space? Our sellers, we have everything from jam to chutneys, jewelry, furniture, clothing, etc. in both shops. We have exhibition space in both shops, and workspace, and we also have a 7,000 square foot workspace in the centre of Leeds as well. Within there, we have a woodworking space, a jewelry space, fashion space, photography studio, all of which are all rented out at below market prices. So you can come and rent the photo studio for £5 an hour. Your workspace, you know, is about £85 a month, depending how much you spend. And you can basically have a space to sell on the centre of Briggate, you know, in Leeds, or Coney Street in York. In York, we're right next to Monsoon, and next we share a complex with them, and our lowest rent's £35 a month. And then everyone, say, works as well, between 3 hours, 5 hours, or 8 hours a week, depending on your lifestyle, whether kids, etc. And between us, we can keep it open, and just about make it run, really. When we first started, like Ready, we were very green, had no idea what we were doing. Back in 2008, you couldn't have a card machine. And when they started to come in, there was still a lot of money laundering. So a lot of our makers could have their own card machines, but they could only use them on their own when they were working. Systems have changed now. COVID's changed a lot as well, but we learned an awful lot. And we just got to the point of actually being, I would say, professional, and not running it with a hands, fingers crossed behind our backs and a wing of prayer. As COVID hit, we've cracked this, and then it all goes to pot again. We had to pivot. The workshop was basically funded by some of the spare commission from the shop. I don't get paid a wage because I have my workspace and I do teaching, etc. So I'm a maker and a worker in there. I do my 8 hours a week like everybody else. You know, so doing the overarching stuff and paying the bills. We work a lot with community, so we also have our charity space in the shop. We sell work by learning disability adults who also work within there, homeless charities, etc. as well. So we are great supporters of local organisations and give them platform as well. It's, you know, I'm incredibly proud of the fact that we have artists from drug and alcohol abuse and learning disabilities selling their work alongside our, I would say in air quotes, normal artists and makers. You know, there is no differentiation. I'm really proud of that fact. We offer work experience. We have our exhibition spaces. We did a big project last year with St John's Arts University in York, that we offer them a place to actually learn the commercialization of fine art. So when they left, you know, they would know actually how to make money from their income, really, because it's the same as what we're doing. We are currently in the process of setting up a cafe space in the same way. So someone who wants to try a cafe, doesn't want to take on a full lease, can come and try it with us for a little while. You know, so it all just kind of feeds through, and we're constantly growing, having ideas. For the first time this year, we're actually putting our own exhibition call outs out, so becoming a proper arts organisation, which is quite exciting. And it's just all kind of, again, organic growth and learning. What we do now as well is that we are starting to work with a couple of community groups in other places to help them. We have what we call our little hand-holding franchise, that we can kind of give guidance, all our past mistakes, what works, what doesn't work, what we didn't know we needed when we first started, whether it's the right type of insurance or you know, many legalities, trading standards legalities, that kind of thing. We're working with a local library group to look at how they improve their library shops and how they can make them more local, and develop rather than just having, you know, generic cards, etc. in there, how they can make them more pertinent, which is quite an exciting project that we're just about to start. I've been, you know, speaking to a friend in different areas. We're looking at something in Portsmouth that we're helping with, Salisbury, and up in Aberdeenshire as well. So yeah, it's pretty much it, really. You see lots of pretty pictures of wrecks that we took on, with me just going, it'll be fine, fingers crossed, we'll find the money somehow, and then it growing. You know, and we are looking, we've got our York shop, and the whole area is being redeveloped, and we have that till January now next year, they've just extended another 6 months. So we're now about to look at taking a 10-year lease on in York as well, which is very scary to have, you know, 2 proper big girl leases. But it's great that actually to show that you can start as a little pop-up, but the progress doesn't mean you don't need to stay there. You can grow until you actually do become at that point. And 13 of our shops, of our sellers, have gone on to open their own shops now in other parts of the country. We even supported one in Switzerland. What was lovely at Christmas, actually, they were the people from Leeds, and they popped over, family, and they popped in to see me. And that's been about 8 years they've been going now. And to see their growth as well, similar trajectories for all of them. And we could all step in and help our other sellers as well, their shops.
Dawn, thank you. And just on that point, if anyone is doubting on this call the kind of reach and impact and sort of the amount of things you've done through this, I think we've got someone in the chat who is saying they bought a pair of earrings.
Oh, that's brilliant.
10 years ago, 10 years ago at the space behind the Corn Exchange. So, and we've got other people saying that they're definitely going to come and visit the place in York or Leeds. I'm trying to keep track here. It's the most interesting one to follow as I'm skipping slides along. So, really amazing. Ian's got his hand up, so we've got time for a few questions. Thank you everyone who's on the call. We've still got over 150 on. Let's start with a couple of questions for Dawn, and then perhaps we can cover off a couple on the wider discussion about how all these things are happening and how they're being enabled, really. So, Ian, you've patiently had your hand up. You come in.
Thank you, Dawn. You mystically read my mind, and you've now covered the point I was going to raise, which was just to get you to emphasise, because there's lots of brilliant things about the initiatives that you've run, and you've covered all of them. And just wanted to pick up that very last point about the number of businesses that have spun out from those that you started and gone on. So thinking it from the perspective of places that are thinking about vacancy and thinking about getting new businesses in, one of the really inspiring things about these initiatives is that they're producing some more pipeline of businesses to take on those units.
Yeah, and we've also, and then it gives other platforms for our sellers to also sell in other places. It's kind of like a complete ripple effect, really, which was something we didn't expect to happen in the first place, but actually has grown with it. And we all work in different ways. So we work, I suppose, as the mothership in a way, with our peculiar quirks and ways, because that's the way I want to work and the way it works for me and running my own business alongside it. And I always say we work from bottom up as well. So one of the things I didn't say was there's a lot of town centres consultancy stuff happens of how places should look and be. But they don't necessarily talk to the people who are actually in it and doing it about how that can be done and what is actually needed. And with the hand-holding franchise, that came around because I was asked a few times, as we've had discussions, could I take on a shop in wherever? And I don't have the mental or physical capacity, and I don't want to do any more rotas, etc. But also it will be difficult, and I don't feel I can come in and tell you how your town should run. But what we will do is work with you to help you tell me, and then we give you the pointers, that kind of thing. Because the way the high street is going, there's it's a lot of I think it needs to become more community minded, and this then feeds into that community and asking the people what they want rather than being told what we need. One of the things we did do was a community project, a heritage project in York, which looked at the high street with a shop there from 1600 onwards, and it was interesting to look at how it needed to go back to an upstairs spaces were all used because people were living in them and everything. It was quite an interesting way of looking at when it changed to corporate and commercial, and how it needs to be pulled back to a nice balance, really.
It's just to comment on that, it's really clear, because I was going to say the model, if you can call it that, and it sounds very reductive to call something like this a model. It's got so many individuals and such a lot at the heart of it, so let's not call it a model. But I was going to say it's resilient, but it's proved more than that because of the growth that you just talked through. It seems a shame to come to some of the nitty-gritty bits about sort of models, but we're getting some questions in the chat. So I guess just to pick up a couple, if you wouldn't mind answering. So Tarek is saying, what would you in an ideal world look for, they're saying from local government, to do in order to facilitate and make leases attractive, or make it attractive to organisations like yourself to take those spaces? Is there one or two things you could highlight?
Leases are difficult because it's pension funds, and I mean, even now, even with our background and our growing and all this time, when we came to try and find another shop, we enacted the break clause, because where we were in Leeds, it's not work. We were too near the offices. We're only 3 streets away from the centre. We were too near the offices, who were still only coming in part-time. A lot of them have moved to a different area with all the regen that's happening. This is Leeds, in Leeds. And we were looking at where we could go. And the shop we took with one, actually, I always thought that would be quite a nice little shop for us. It's not as big as I want, but, we all want bigger and huge and, and that. And even then, I had a couple of agents go, oh, you don't want to be on Brugger. It's not for you. You're an independent. You need to be in the Corn Exchange or St. John's. Like, I was in the Corn Exchange 20 years ago. I was in St. John's 10 years ago. We're as good. Our work's as good as anything that's been sold in Harvey Nichols. Our sellers, I want to be on Brugger. I will be on Brugger. No one's stopping me being on Brugger, and we will pay that premium, but we will do it. So you still have that from, this wasn't even the landlord, this was the agent preventing me looking at a unit. And the same agent that prevented me doing that back in 2018 as well, looking at a different unit, which actually the shopping centre then gave us a temp one till we got our lease. So you still have that bias. And hopefully there's someone here who will, there may be some agents on here. I'm determined to go and actually get that agent to come and cut the ribbon when we do our official opening, just because. The main thing that local government can do, and it is hard because of business rates, is that they can put in business rate support for community organisations. A lot won't. They will do the charity one, but if you don't fall into the charity bracket, we don't in York. We don't get small business rates relief in York. We do in Leeds. We get a social enterprise one, and at the moment, of course, we've kind of got the COVID relief, so that's kind of by the by, and Leeds has dropped the social enterprise one. But the biggest thing, that local government can do, and where it's adult social care money and everything as well, so it's hard, is to actually do that rates relief, whether it's 50%, 80%, just to get you, just to get you going, just to try. I'm always prepared to go in and try and fail. Or I was brought up with where there's no such word as can't. You give it your best. If it doesn't work, it doesn't work. But I will have tried my best to do it, and look at. I think one of the things that are actually small organisations like ours, like Joe and as well, is that because we are boots on the ground, we can pivot. So if we can see that that will work, we add it in. We had just before COVID as well, when a local refill shop in Leeds had to move. We had an area that was perfect. They just moved into us for a little while, that kind of thing. So we have that space and that capacity to help people take little areas within, just to trial it, really. And if councils can give that when they're looking at bids and how, not put a 4-month limit on it, put a year limit on it and a 2-year trial, small amounts of money for the first year, a little bit more for the second, just to baby steps and just give everyone a chance. You can put play in, you can, which fits in as well. And I'm kind of rambling, but I wish I do my brakes spinning.
Heard it loud and clear. It is one of the inevitabilities of life. Any conversation always ends up back at business rates.
Yeah, it is.
But it's a really good point. And just to your other points you made about, hopefully some more agents will come on with this idea. I see some in the chat as well, agents being extremely complimentary, saying that, this is definitely something that they would rank right up there alongside your traditional, just national retail model. Yeah. And also we know of, and you'll be well connected to these, of course, towns and cities around the country that are looking at crafting a creative identity as part of regen, and we've done some work with Sunderland, who are putting that at heart some of the regeneration in Sunnyside. Farnham's mentioned in the chat as being a town that's really centred on that. So, and hence why Ian invited you to speak, because you're already a massive asset in the spaces where you are for that reason. I think just to, we've got 8 or 9 minutes left. I don't propose we take all of that up. Just to finish on that point of the sort of financial aspect. Dawn there has talked about giving a leg up really to try things and see what will work on high streets. Just perhaps Wayne and Harry first, and then I'll come to Joe. In terms of your modelling for what you're doing with health, and when you talked about not coming cap in hand and expecting to get it for free, are there any financial risks in terms of the ongoing overheads, rates, whatever it may be, that you have to model in there? Is it, I presume you're not totally dependent, these units have opened, you're not dependent on national government decisions, but how do you model that and think about it?
Harry, shall I go first? Or
Yeah.
Don't mind. Well, we do a lot of due diligence in advance of taking any leases and producing the business cases. So we do model the likely overheads that we will incur, and we make an allowance in the budgeting for anomalies that will come up at some point, and they have done. Where you, for example, we've got a basement that needs pumping out water, and we're going to use the basement. That wasn't in our initial projections, but it was covered by the overheads that we added into it. So I think the key is to do a lot of due diligence. We do lease a lot of property anyway, and a lot of it has been in traditional commercial offices. So it's about diverting the budgets that we have associated with that type of accommodation towards another different sector, which is the high street model. And we will be moving people out of traditional offices, because that is the institutional type environment that I was referring to in my presentation, and is not necessarily the way that we want to move this forward. But yeah, do the due diligence. You've got to map it out. Get your FM teams involved pretty quickly, because they need to be engaged with this. They're the ones that are going to have to own it afterwards, and make sure the fit out covers as much everything you need to do now. It doesn't store problems for the future.
Yeah, I'd further what Wayne was saying there in terms of just doing the due diligence. So obviously there's kind of 2 sides of the deal, being the landlord side, which is where I've been sat, and then the tenant side, which is similar to what Wayne has been saying. So effectively, obviously the tenant needs to be able to do all of their business planning in order to ensure that they can deliver any of the capital works that they are signing up to do, whilst also delivering the OPEX for the rent. And then similarly with the landlord, again, is you need to make sure that you've got the capital available, whether you need to get some funding to do that or whatever, and then appraise the model to make sure that it works for both parties, really. And I mentioned a couple of examples of the ways in which our leases and agreement for leases has been structured in terms of who puts that capital in first. So Ilford being an example where the landlord has put in the capital contribution and then is recouped through a higher rent. So yeah, it's doing the due diligence to make sure that it works for both parties, really, and then structuring the deal to make it reflective of that.
Yeah, good advice. Okay. Joe, I don't know if there's anything you wanted to add, just maybe not specifics on the rates, but just to close us out about your own journey, I suppose, putting in a similar, reflects what Dawn's been talking about, the amount of effort that's going in from a community of people. How do you see the future for Wantage Mix and your organisation?
So as Mim said, recently we managed to get a 3-year grant from National Lottery. So at the moment, this is very much about shoring up what we've done so far, making sure we can carry it forward, and finding out what our opportunities for income generation are, whether that be from core cost funding or from new projects, or whatever that might look like. So we're really in a point of kind of consolidating. None of us are business owners, or particularly business minded. It's been a very steep learning curve, but we've been very lucky to have lots of good advice from a lot of different directions. Yeah, and very much like Dawn says, you just got to try and see what happens, and that's how you find out what you need to be doing.
Yeah. Well, I think that's a great point to close on, that you just got to try these new things, new uses, new groupings of people, new enterprises, and we definitely get a sense of the energy and the creativity and the drive that you're all putting into these, very different uses. So really appreciate your time. Thank you again. We really include you when we do the follow-up. There's a wealth of information in the chat. There's your slides, there's a recording of the session, which will get into some kind of shareable format so you can all digest and follow. And perhaps even Dawn meets up with the person with the decade-old earrings and find out what the story is there. That's from the webinar. Okay, well, thank you everyone. Have a great afternoon, and thanks for joining us. And we'll see you again soon.
Thank you. Thank you for inviting.
Thank you. Bye bye.